welcome to the final webinar in our Women's Health Month series. I'm Fred Wyand with the National Cervical Cancer Coalition, a program of the American Sexual Health Association. We're really glad to have you with us today. So our topic is going to be cervical cancer care. And while we'll cover traditional approaches, we'll also chat about innovations in therapy, and we'll address some of the questions we receive around holistic care. We actually get a lot about that. And we have a very special guest to cover all of this with us, Dr. Mamta Singhvi. She's a radiation oncologist, a women's health expert, and beyond that, she is deeply involved in community service and advocacy, especially around health disparities, which is such a big issue, an ongoing issue in our field. She's one of our medical advisors, and she's been on our board of directors, so we know her well and we owe her quite a lot. So Dr. Singhvi, thank you for taking some time with us today, especially on the cusp of a long holiday weekend. You're kind of working overtime, so welcome and thank you.
Thank you so much, Fred. It's such an honor to be here, and I know it is the day before a long weekend, so I'm just grateful for whoever's tuning in.
There you go. There you go. So let me ask you, you are a board certified radiation oncologist. So just tell us a bit about what that is and what do you do?
So essentially, whenever a patient has a cancer diagnosis, if they decide to go the conventional route, there's three different kind of what I call arms to the cancer care kind of picture as it is in the Western world. And that is surgical oncologists. So you can go the surgery route. Then there's medical oncologists, who are the ones dealing with chemotherapy and immune therapy. And then there's radiation oncologists. And that is exactly what I do, which is treating the cancer with radiation. And depending on the patient, their age, their other medical issues, the stage of the disease, a patient could require all three of those, one of those, or none of those, or two. I mean, it's just kind of a smorgasbord when it comes to looking at each individual case.
So we're very big on trying to empower patients through education, like on the screening side. We have tools to prep patients so they understand things like PAP and HPV tests, what's involved, some of the terminology they might hear, that kind of thing. Thinking about the treatment side, what you were just talking about, if you were beginning the journey with a new cervical cancer patient, what would be some of the pearls of wisdom you might want them to know about so they can know what to expect and really maybe how to prepare themselves better?
So I think that is such a critical question, because as physicians, as the medical fraternity, we kind of just whip right into treatment and prognosis, and the patient's head just starts to spin. And it's so critical to just take a moment to touch base with yourself, to make sure you feel like you're in the right hands. Second and third opinions are always encouraged by me. You really need to feel like your doctor is going to be your biggest advocate, your biggest cheerleader. And of course, they need to know their stuff. They need to be worth their salt. But they also, that I can't emphasize enough the importance of compassionate care, of quality bedside manner, especially in a journey as intimate, as vulnerable as cancer. So I would say that's important, to choose wisely and to take your time. Yes, we don't want to take all the time in the world because we want to get in front of the 8 ball, but a few weeks here or there and is not really going to impact things. So I would say that's first and foremost. And then I would also, just to go back to your initial question of what is radiation. So depending on the stage of cancer diagnosis, specifically cervical cancer diagnosis, treatment options kind of run the range. So if it's early stage, it's usually limited to surgery. And if it is later stages of cervical cancer, it's a combination of chemotherapy and radiation, and surgery is usually left out. So depending on where you are on the spectrum with cervical cancer, you can really see every single one of those modalities. Now, I have a lot more to share on wisdom, but I'm going to throw it back to you and ask if there's anything to clarify or what else I could share.
Sure. Well, and as I was listening to you talking about the fact that, there are three primary approaches to therapy, and it often involves a combination. That can mean really like almost 2 or maybe 3 separate care teams the patient may have to interact with. I mean, certainly more than just like, one doctor and one nurse. There's a lot involved in that. And I would imagine that can be a little bit, well, maybe a lot intimidating, maybe even a bit overwhelming. I mean, everybody's got their own style and their own approach. Is that, I mean, any advice on how patients can just sort of take a breath and interact effectively with like all these different people.
Right. That is such a, it's absolutely a conundrum because as you said, it becomes overwhelming really quickly. So I always like to tell my patients that the quarterback of care generally always is the medical oncologist. So that doc is going to be with you from moment of diagnosis through the follow-up scans, through the years and years of follow-up post-treatment. The radiation and the surgical oncologists kind of just fall by the wayside. They're just there for kind of the acute part of the illness and the treatment, but they generally don't follow the patient long term. So that makes it a little bit more streamlined. Your I guess focal point is always going to be the medical oncologist. I would also say that yeah, while it's already complex with 3 different types of physicians potentially, I want one of the things that I'd love to share with patients is don't forget that, Western medicine really emphasizes the physical aspect of disease, but there is, as we know, mental, psychological, emotional, spiritual aspects to this as well. And I would actually go so far as to say it might actually be even more meaningful and overwhelming in these other dimensions. So I'm not surprised if a patient comes to me with this huge team. We got an acupuncturist, we got a homeopathic physician, we got a naturopath, we got a med onc, we got a rad onc, and it just kind of builds. And so
Wow. Yeah.
yeah, it could be really overwhelming. But again, I think I'll say this, the distillation of kind of this question comes down to you have to have a team that supports you, that trusts your autonomy. Because if you're dealing with kind of holistic stuff out there, then you want to be able to have transparency with your medical team, telling them exactly what you're doing. And that's going to ensure safety and success to the journey. So,
Mm. And as I was listening to you, it just triggered a thought about patient navigators. Some institutions have things like that, right, to help patients just so well navigate the system, especially since it can be just so overwhelming. Is that something that's commonplace? I mean, how does the whole patient navigation thing work?
so it is in your big centers. Usually your big academic centers will have someone to kind of a social worker or someone to help the process along. But that is not commonplace in your smaller settings, which is, pretty bare bone, quite honestly. There's
Yeah.
usually the physician and the nursing staff and then the therapists, but I've never really seen social workers and such in these small private practices.
Right. Right. Okay. So I have an array of notes here, and I'm just like all over the place. I'm like, I want to ask her this. I want to ask her this. So I'm just going to run with it. Okay. So let
Please.
me switch gears a bit. We often talk to patients who say they experience some difficulty with sex and intimacy as a result of their treatment. And I'm sure there are a variety of potential issues that might emerge depending, like you were talking about, their specific diagnosis, the exact treatment plan they're getting. So I understand it might be a little hard to generalize, but what are some common issues with intimacy that you've seen with your patients? And I think importantly, their partners in terms of dealing with that they have to deal with following treatment for cervical cancer.
A few things. So I would like to point out that NCCC is actually under the umbrella organization of American Sexual Health Association, which is a fabulous resource for anyone out there listening and wanting to know more. So I'd start with that point. And then I would say, the entire process, when you're dealing with something gynecologic, you are being poked and prodded by, as we've already discussed, a number of people. It's a very vulnerable time. And not just because it's a life-changing diagnosis with cancer, it's actually the specific area that we are dealing with. So there needs to be, again, a heightened sensitivity on the part of the medical team. And this is where that centering for the patient really comes into play because you need to know what you're comfortable with. Ultimately, you are boss. So if you don't feel like you can go through yet another pelvic exam and it probably won't add anything because you've already had multiple, then you need to be able to voice that out loud. And I've just seen that time and again when the minute a patient walks in, it's like suddenly there's a hierarchy. Suddenly the physician is kind of on this pedestal and whatever they say goes. And my heart goes out to that because we've all been on the other side where, you're just kind of stripped of agency. And that's all we really want to be able to encourage our patients is you have to be comfortable over and over, especially when you're dealing with something like cervical cancer. So that's one point. Another point that's kind of, I guess, more technical is if you're going through, say, radiation for cervical cancer, there will absolutely be changes to the anatomy, and that could be shortening and tightening of the vaginal canal. That could be atrophying of the muscles. That could mean decreased lubrication. So, all of these things are ideally going to be discussed with the physician preemptively. And so, as you're going kind of through the aftermath of treatment, there's going to be regular follow ups to make sure that these points are touched upon. Are you using the dilator that we gave you? Are you potentially going out to pelvic physical therapy appointments? These are the sorts of things that can kind of be assumed maybe needed down the road as things have been altered and take some time to get back to kind of a new normal baseline. I'll pause there, and then I'll get into partnership as well.
Sure. Yeah. Thank you. Because that was going to be the next thing I was going to ask you about. But yeah, just to stay with this particular Q&A for a minute, I'm wondering how difficult it is for patients and providers to have conversations around sex and intimacy. I have no doubt that with your patients it's absolutely fine, but I would imagine a lot of folks not so much. I mean, is this still an issue, or providers really just pretty comfortable talking about this? I mean, where do you think we are there?
So I'm going to give you kind of a subjective opinion, and then I'll be as objective as possible. So subjectively, I do think that is a challenging topic. I mean, across the board, whether it's in a physician's office or outside, just two partners talking about it can also be a challenge. So you got to give, kind of the medical team a bit of benefit of the doubt there, and be able to, again, be your biggest
That are associated with almost all cases of cervical cancer. So you're talking about cervical cancer. I think you've got sort of a double or triple whammy in some ways. It's well, cancer, just there's stigma around cancer itself to begin with, for one thing. This is a cancer of reproductive organ, and it's caused by, as you say, a sexually transmitted infection. Even though HPV is a common cold of sex, virtually everybody has it at some point. Still, you've got a lot to unpack there, And I think that with gynecologic cancers, especially with cervical cancer and the HPV link, you're exactly right. That's always been hard to talk about. And I think that's part of the reason why when we talk about the vaccine, so much of that is positioned as a cervical cancer vaccine rather than an HPV vaccine, and yeah, that's where we spend a lot of our time working. So thank you for touching on that. Do most of your patients, would cervical cancer patients, are they familiar with HPV by the time they get to you? Do they ever have any questions about that? I'm curious what those conversations are like.
I would say I'm kind of at the end of the line when it comes to treatment. So they usually have their questions either answered by Google or by their
Dr. Google.
or by their
Yeah.
physicians earlier on. I do want to touch on something that you commented on, which is the geez, I don't know how to say it, the additional layers of complication
Right.
that come along with a diagnosis. Actually, I'd say specifically with cervical cancer. I don't see it in ovarian or uterine or
Mhm.
breast cancer. I see it purely with cervical cancer, perhaps a bit with anal cancer, but
Sure.
definitely with cervical cancer. And I, again, like, I've been blessed to meet hundreds and thousands of patients across the world and really kind of have been able to observe the mindset of patients. And what I've found, again, this is just my pure experience, very humble experience, is that cancer is going to bring up emotions, right? It's going to bring up anger and rage and sadness and confusion and depression and hurt. And I mean, I could go on and on and on. And
Mhm.
dealing with these so called difficult emotions is absolutely critical. There is no sweeping under the rug allowed, especially in my clinic. But what I will say that I bat away as soon as I feel any sort of tinge of are what I call secondary emotions, right? So that's the guilt, that's the shame, that's the I'm already struggling and suffering, but now I'm going to heap on people's judgment and other people's opinions and what popular culture thinks and what I've been told. And that is just, it's just not allowed, because that makes everything so much worse. It is absolutely uncalled for, it's inappropriate. And
Sure.
I frankly think we need to do a better job as a community to destigmatize things like HPV, sexually transmitted illnesses, um, cervical cancer. And I think that's where ASHA really is leading by example and trying their best as an organization to push that message through.
Exactly. We spend a lot of our time working on what we call the psychosocial aspects of it, because that no matter no matter the specifics of the diagnosis, it always tends to come back to that. And I think you are exactly right. And we know that the stigma and the shame part of it is a real barrier to care. We're talking about patients here, but we know that there are women who sometimes have trouble just going for their gynecologic care and their exams because it's embarrassing. It feels invasive, understandably. And so when you're again layering and stacking all this stuff on top of it, I mean, I don't in any way want to be negative or doom and gloom, but I do want to be realistic. And this is a barrier, and I think you're right. We can do a lot to to change that. And one of the things we do is we try to normalize these discussions. Like when we talk about HPV, we do call it the common cold of sex. We tell people if you have sex, pretty much you're going to have HPV. And one of my lines is, do you know what it means if you have HPV? You're normal, you're human. And I think that kind of perspective, is important to bring to it.
I love that. I love that. I mean, studies are, it's hard to actually do studies on the prevalence of HPV because, as you know, most people won't have any symptoms over the span of a lifetime. And so you can't really tell, but estimates say at least 80%, if not upwards of 90%. So
Yeah.
that's, as you said, pretty much anyone and everyone is going to have this at some point or another. So why should we be embarrassed about it? And I think that's one of the reasons you don't see much attention being given to cervical cancer awareness, because of these emotions of the shame, the guilt, the stigma, the taboo. And again, I've been working really hard. You've been working hard to change things in this country and beyond, because that's a whole new can of worms.
There you go. And I should have mentioned earlier to all the attendees, we are happy to take questions. If you want to put them in the chat or the Q&A box, please do so. We'll wait to the very end, then we'll come to questions. And I apologize for not mentioning that, but please, we'd love to have you take part. So you got feedback, thoughts, or questions, we'd love to hear them. All right. So you had mentioned earlier about the partner side of things. So let me explore that with you a little bit. So yeah, this is not all related, of course, to the physical aspects that we've been talking about. I mean, it's difficult emotionally, and with that, you've got partners, especially if sex and intimacy become difficult. How do people communicate? I don't know that we've got a model to really base on. I mean, it's not something that people really know how to communicate about. So this can be tough at home. I know. Any advice or tips from what you've seen over the years about how patients and partners can really communicate about this effectively?
Um, I heard something the other day, which is a bit tangential, but I think it's important. It's not, we really emphasize the importance of communication, but it's a two-pronged approach. It's communication, and there's got to be comprehension too, right? You have to really understand to the best of your ability what is happening, what the patient is going through, what the partner is going through. I would say, not necessarily specific to cervical cancer, but something again I've observed along the way is at the beginning of my journey as an oncologist, I was really taken aback by the number of divorces, separations that would occur once someone was diagnosed with cancer. And I always was so startled by that. It really jarred me, because I really thought that when someone's going through a tough time, everyone kind of rises up, everyone becomes kind of a champion and a cheerleader. And it took me quite honestly a while to understand the why behind the divorces and the separations. And I think one of the main reasons, Fred, is because when there is nothing in your cup, you cannot give to anyone else. And so often what happens is that caretakers and patients alike are completely depleted. So no one has any sort of kind of, I guess, flexibility. No one has any sort of anything extra to give. Everyone is just literally running threadbare, cup completely empty. So I would say the most important thing is to be mindful of this, because as soon as we click on to like, that's what's happening, I'm tired, I'm exhausted, I'm upset, I'm sad, I'm hurt, I
Mm.
can't talk to you because I want to be your, your cheerleader, and I want to be peppy for you, and I want to be positive. As long as we give voice initially to what's actually happening, that's, I think, the first step. And then the next step is absolutely to get help, to constantly do your best to get your cup full, whether that's taking a break, whether that's asking for family and friends to step up, whether that's psychotherapy, whether that's couples counseling, whatever that is. That's a wrecking room, that's, I'm not even joking, wrecking room, boxing classes, shooting range, writing therapy, scream therapy. These
Yeah.
emotions need to come out, and they don't need to come out inward. They don't need to come out towards yourself or to your loved ones. They need to come out in a productive, healthy way. And that is when we look outside.
That, yeah, I'd never thought about that. That is a way to sort of channel some of that rage and all those feelings towards, a punching bag or something, rather
Mhm.
than screaming at somebody.
Mhm.
I've never heard of a wrecking room, but that makes perfect sense now that I hear
It's
you
a
put it in
newfangled
context.
thing.
Yeah.
I was planning on trying it myself, but
Yeah. Hey,
people
look,
love it. People seem to love
exactly.
it because, again,
Ex-
these emotions are real, and no one is going to deny them. I actually feel worried if I worry about denial if I don't think that there's some level of anger and sadness, right? So there has to be a certain sense of that, and it has to be proactively and productively dealt with. You know.
Yeah. And I know sometimes when HPV comes up in the conversation, there could be a bit of a blame game going back and forth. People don't understand how common it is that this is something a person could have had for a long time, years before really anything manifested or was detected. But we talk with folks a lot who have some real relationship. Who have you been with? Why is this showing up now? So that really can complicate it too. And I wonder, somebody once told me that uh, sometimes a partner might have trouble. The issues with intimacy can also be on the partner side because they may worry, can I make this worse? Can I hurt you in some way? That kind of thing. So it just seems to me we need to do more to have resources for partners and to include them. I mean, there's got to be a grant in there somewhere, Mamta. So
I agree. I agree.
yeah, yeah.
And I would say that, again, that's where it's so much of this journey. And I know I don't have necessarily the most conventional approach to it, but so much of this journey is a very spiritual journey. And by that, I mean tapping into yourself, into your feelings, what feels right. Like, if I'm going to be intimate with my partner, does it feel right, or is it painful, or am I not ready for it, or is it, all of these things? No one can really, there's no silver bullets here. There's nothing that can be said that is applicable universally. And so I think cancer, is an invitation to dig deep, to dig inwards, to peel back the layers, to figure out not only what you need and what you want, but what brings you joy. I mean, that's one of my favorite parts about my kind of career, is that every day I am dealing with people who are at an inflection point in life. They're learning, hey, this is a wake up call. My back is against the wall. This may be it for me. I need to change a few things. I need to start living the life of my dreams. And you can't do that if you don't take the time to know yourself.
It's about a lot more than speculum, shots, and pills, right, Doc?
Right. Yes, Fred. I think
There,
you get that. So,
there you go. All right. So let's touch on some more treatment stuff, but a little bit of a twist. So you mentioned that the mainstays are basically a combination of surgery, chemo, and radiation. We get a lot of questions and even a lot of media requests about the latest research. What are trends and treatment options? What's new and different? So is there anything that has you particularly excited in the way of new or innovative therapeutic approaches? I know like immune therapies are one area. Just what's on your radar screen? What are you looking at?
I was thinking about that before we got on this call, and I have to say that there's not much new when it comes to cervical cancer treatment. I would say that maybe, you get the latest and greatest radiation machines that are more, the precision is improved, or I wouldn't even say the course of therapy is necessarily shortened the duration. So I would say that in the treatment realm of cervical cancer specifically, there's not much to report. However, I think there are some very fascinating studies that are coming out that go beyond that particular realm. And I would love to touch base with you on a few that I find most interesting and I think are actually probably more pertinent because, not everyone's gonna have cervical cancer and not everyone's gonna be treated for it. So I like to, as you know, I have a public health background as well. I also am very interested in holistic medicine. And so much of the conversation in those areas is about prevention, right? So one of the studies that I found very interesting, one of them I'll share with you was about ovarian cancer. And we are in Women's Health Month, so I'm not going too off topic. And that was so fascinating to me. They just proved something that I think you or I or any of the attendees are, no one would be surprised by, but it's always nice to have scientific backing to a hypothesis. And that is that women who have dealt with PTSD, any sort of traumatic event, are significantly at higher risk of developing ovarian cancer. Now, for anyone who's out there saying that emotions do not affect our physical health or thoughts and belief processes don't, contribute to disease down the road, I'm going to call hogwash on that. And these sorts of studies are showing this, every single day that we have to be very much in tune with, again, the entire psychosocial, as you mentioned, the holistic approach to disease. So that's one that I found very fascinating that's come out in the last, I'd say, year. And the other one specific to cervical cancer has to do with, I think it was Harvard that put out a study that said that cervical cancer elimination, so we're talking elimination, we're talking end game, is possible within the next 2 decades. So in our lifetime in the United States, with ramped up screening. So I would have guessed that they would have said with ramped up vaccination, but it's
Mm.
actually specifically if our vaccination rates remained as they are today, it's actually the screening percentages that are going to be um, bringing the end in sight, which is so exciting to me. And on that note, I'll mention to you that the goal is 90% screening of women. There, at this point in time, we have 15% of women who have never been screened in their lifetime. And that's in the most developed, richest world in the country. So again, imagine in a place like India or sub-Saharan Africa, right? So we have a lot of work to do, but I think it's very promising that we are actually finally talking about a potential end to this deadly disease. And it would be the first cancer that could potentially be completely eliminated.
And that segues nicely to the intro I did when I mentioned that one of your interests is health disparities, because cervical cancer, as I understand it, is largely a disease of poverty. A lot of it has to do with, do you have access to the healthcare system? I mean, we have a great double-fisted approach to cervical cancer prevention: the screening, which is really effective, and the vaccine, which is an amazing public health triumph. But they don't do any good if there are significant barriers to you accessing those things. So I think that's a big piece of it. And I'm glad you brought that up. Yeah, I mean, even here in the U.S. with a very developed health system, as you said, we have a lot of people just falling through the cracks or not getting what they need, and in some other areas, that's just going to be magnified. And it's heartbreaking. I mean, virtually every case of cervical cancer is preventable, and it strikes women in the prime of their lives. I mean, it's just, there's just so much more. I guess that's why we do this work. So
Yeah,
thank you for touching on that.
thanks, Fred.
Um, you mentioned, well, back to treatment just for a second. You mentioned that maybe there haven't been as many new innovations as we would perhaps like. And I was going to ask you about referring patients to clinical trials, when that might be an option. I understand that it's kind of tough to do clinical trials for cervical cancer. I mean, recruiting and importantly, retaining subjects can really kind of be an issue. And I guess maybe that's part of what hampers us. I don't know. But I'm just curious, do you ever refer patients to clinical trials? When might that be a good option?
So I think so I would say that's not limited to cervical cancer in terms of retention of patients and recruitment of patients. I think it's anything, any cancer that we're talking about. If I was to talk about, innovations or when clinical trials are appropriate, it's usually when things are end stage. So terminal illness, absolutely. You go far and wide and find whatever it is that the patient is willing to try to maybe tack on a few more months, a few more years if we're lucky. And that's when clinical trials, especially in cervical cancer, because the cervical cancer kind of treatment paradigm has been about the same for many decades now. And it's rather successful, again, if we can catch the cancer in its early stages. So when we're talking clinical trials with cervical cancer, it's usually once disease is metastatic.
Okay. All right. And in the episode notes for this webinar, we'll put some links to databases where people can learn more about clinical trials and see what's available in their area. So we'll have some click throughs for you there. So I want to ask you about cancer care in the middle of a pandemic. I know COVID has just, of course, roiled everything over the last 14 months, including healthcare. Would you talk a little bit about the challenges that the pandemic has brought for cancer patients? I don't know if there's a specific discussion here around cervical and gynecologic cancers. I'd love to hear if there is, but just in general, what's it been like for you and your colleagues over the last 14 months or so?
Well, I think at the beginning, as it was for everyone, it was just scrambling, trying to figure out what this is, how best to approach it, how to protect our very vulnerable immune compromised patients. That was key. And so we had to make some heartbreaking decisions. And I think that the thing that bothered me, and actually is continuing to be done in a lot of centers, bothers me, so I'll say active state the most, is that a cancer diagnosis, as you can imagine, is not easy to swallow. And then to have to hear that news and then proceed on your journey with one appointment after another, with one scan after another, completely on your own, without any sort of support system, without another set of ears or eyes, which is what's been the case, right? People cannot bring their significant others, their family members, their friends to appointments because it's been about limiting bodies in the room. It's been about protecting everyone else. And so that's been really heart-wrenching for me because the fear becomes actually palpable. It just everything ratcheted. I can't even say the word, but everything ramps up a notch when you don't have your team around you, your personal, private kind of entourage around you. And so that's been really hard. I would say that that's hit cancer patients the most. It's one thing if you're going in to get, like your annual your PAP, right? Like it's obviously different. But if you're going in to deal with a life-changing, life-altering diagnosis and you don't have someone by your side, that becomes really hard. So I would say that's one. Another thing that's been happening is preventive appointments have kind of
Mm,
gone by the wayside, right? And I'll use myself as an example. I'm embarrassed to admit that I don't remember the last time I got, for instance, my teeth cleaned, right? Like that's just something that like I can deal with that later. This is not the right time to deal with it. Why should I expose myself? Blah, blah, blah. So there's this
right.
kind of running dialogue. It's already not something you want to do. It's not like signing up to go see your doctor is exciting for anyone. So, and I've talked to my general primary care physicians, my OBGYN, and they've absolutely seen a lull when it comes to people coming in for their annual exams. And that's really key because I don't want to see you in my office. I would absolutely rather we nip everything in the bud and you don't need the chemotherapy or the radiation. So I would say that's a big one. And hopefully things are starting to change now that we see vaccinations and kind of light at the end of the tunnel, that people are starting to wake up back to, hey, I got to get back onto the routine.
That's an important point you touch on, that there have been a lot of missed visits, understandably over the last year or so. And it's not just for screening, there have been a lot of vaccine doses that are missed as well. So there's that I know that among a lot of cervical cancer stakeholders, that's a discussion. How can we get people back into the routine a little bit more? If somebody is overdue for their PAP or HPV test, or maybe they've missed a vaccine and they're reluctant to go to a clinic or hospital setting, is there any reassurance beyond maybe encouraging them to get vaccinated? I mean, I know you and your colleagues have just been over backwards to make the clinic settings just as safe as you possibly can.
I would say I think personally a hospital or a clinic is probably the safest place to be. The precautions that everyone has been taking kind of since the beginning, once we've kind of wrapped our head around what's going on, it is absolutely a safe space to be in, a sterile space to be in. especially outpatient clinics. They're doing a great job of sanitizing surfaces and making sure kind of the wait period between patients is ample. So I would say, yeah, it's always going to be scary. There's always going to be some level of fear, but it's as safe of a time now than it's ever been to go in and see your doctor.
All right. Do you think any of the changes to cancer care that have come about in response to COVID are going to be permanent, or maybe some trends are accelerated? And of course, I'm thinking about telemedicine as an example there. Are we going to be doing Zoom calls more and more now with our clinicians?
I think, I mean, I've only seen kind of these polls that large corporations are taking of their employees, who most of them want to stay at home and are liking kind of the setup. I would say with physicians, I personally, of course, it's more convenient. There was a time period where I was working out of home, quite honestly, and that was great. You know, you don't even know right now if I'm wearing my pajamas on the bottom, right? Like, there's something really cool to like the convenience factor, but with something again as emotional and intimate as health, as healing, I think there's something that just is missing when you don't have the palpable kind of connection, the energy of your physician, the healing space. And so that I think people will miss. I know that I've missed it when I've had, because we're still doing telemedicine when it's pertinent, when it's applicable. As long as we don't need a physical exam, then many doctors are still doing that. But again, I think that there's something, there's always advantage and disadvantage. And here I think convenience is great, but you are missing the human touch.
There you go. We're getting a couple of questions and comments. Thank you for those. I promise you we're going to get to those. But before we do that, I've got one last area I'd like to explore. So, holistic medicine. What about things like starting a meditation practice? In CCC, by the way, we actually have a video on yoga and cancer. And I feel like this is an area that's maybe has some untapped potential. I mean, do things like yoga, meditation, mindfulness practice. I actually saw an article in the Wall Street Journal on mindfulness practice talk about going mainstream. I mean, do these things come up when you counsel your patients?
Oh yes, and I bet we could do a completely new, another kind of session on this, Fred, because this is my area of expertise, I would say, and deep interest, and that's for a number of reasons. So um, I think what patients who do well really understand is that demonizing or glorifying one way or another of doing things is counterproductive. So, in the society that we currently live in, so many of us are so polarized. There's a very like, I love conventional medicine, it's the best thing in the world, but oh my God, all that woo woo quackery that's complementary and alternative, I hate that. And what people who do well, the successful cancer patients that I've seen do really, really well, is that they understand it's not A or B, it's
Mm,
A and B, right? So they bridge the gap, they bring the best of every world together. They understand that integrating treatment modalities is going to be the best answer for whatever they're going through. And they understand that everyone's different. So every journey is unique. What works for one person doesn't necessarily work for another. And ultimately, what I'll say is no matter, this is something that I hope that the people who are listening today really understand, is that no matter what is thrown at the patient going through cancer, whether that's chemotherapy, radiation, the most advanced therapeutics, immune therapy, or yoga, Reiki, mindfulness, meditation, a vegan diet, everything is secondary to the human body. Ultimately, your cancer is going to be dealt with and treated by your immune system, right? That is the only thing standing in the way of life and death. So, all of these, even radiation, antibiotics, surgery, all they're doing is supporting the human body and healing itself. So, why wouldn't you try anything and everything that's going to put you in the best frame of mind, the best kind of physical health to be able to handle the situation at hand? So yes, I am all game for, as long as it's a safe intervention, try anything and everything that resonates. And I think I'll end with this. It's critical to find a team of doctors, like I said at the beginning, who are going to be supportive, understanding, and championing you as you try what makes sense for you.
great. Thank you for covering that. And you know what? If your game sometime, I would love to do a session, a podcast, or a video just on that. Because, like I said, I think it's an area that we don't explore enough, and it's good to know that we have a resource. Thank you.
Yes.
All right, we've got questions and comments. My goodness, let me see. Gosh, that is some teeny tiny print. Let me get my progressive lenses up there. All right. So, first one, many patients express frustration when symptoms related to radiation damage emerge, sometimes years later. By then, the radiation oncologist is no longer part of the care team, and the patient may even have been released from the gyn-onc back to their regular gynecologist. Then their symptoms might be downplayed or ignored because the primary or gyn has no knowledge or experience of these long-term symptoms. What do you think about that? Is that something that you encounter?
Totally true. Absolutely. Whoever's stating that is right on point. Now, is it the majority of patients? Absolutely not. Is it a small minority? Yes. But to that minority, it makes all the difference in the world. So I would say a good physician, a good radiation oncologist needs to really spell out every possible scenario that might occur because we have what we call acute side effects that tend to happen during the course of radiation over the few weeks that you're seeing me one on one. And then we have chronic or long term side effects that sometimes don't pop up until years down the road. Now, just the fact that we're even talking years down the road is exciting because that means that you're alive to talk
Mm,
about things that are going to happen down the road. So, would I ever advise a patient, hey, don't do chemotherapy or radiation because X, Y, or Z might happen 10 years later? No, right? But at the same time, to be aware of these are the possibilities. Oh, yeah, I remember my doctor said, hey, watch out for that. Because as we discussed, not many people in the community, like your family docs or your internists, are going to know these things. And you need to be referred back to a radiation oncologist potentially, or a gyn-onc, or a specialization that will be able to kind of shed more light on what's going on.
okay. So, continuing, many patients are left with long-term anxiety about their partner's health, whether HPV may affect them in the future, and then feel guilty about what future health problems they may have, quote, caused for their partners. Doctors rarely discuss these concerns and fears with their patients. What can we do to support more knowledge and comfort among healthcare providers to screen for and refer patients experiencing post-treatment sexual dysfunction to specialty care? Um, you talked about that a bit, but anything to add about that? Anything more proactive maybe health clinicians can do?
I just, as much as I'm part of the medical fraternity and I love my fellow physician, I just don't think you can ever put the onus on the physician. Ultimately, every patient needs to take responsibility for their situation, needs to be proactive, needs to be their biggest advocate and ally. And so my kind of message to every patient of mine is, hey, I'm not going to be, watching you forever. At some point, you're going to have to pick up on, hey, when am I due for my mammogram? When am I due for my pap smear? Because you can easily fall through the cracks. And when something hasn't been caught, I mean, it's not going to be productive to be blaming anyone. It's going to be, hey, I should have thought of that myself, right? So I will just say this is maybe not the message that people want to hear, but you got to take it upon yourself to do what you need to do to best take care of yourself.
Okay, I really appreciate some of this thoughtful feedback we're getting. And just to wrap that one up, the last comment, ideally, patients need access to a treatment team that would include pelvic floor therapists, docs able to evaluate hormone issues, atrophy issues, etc., as well as behaviorists that can address mental trauma. Most doctors are not even asking about sexual wellness post-treatment, much less know where to refer. So, yeah, I think you've touched on that pretty well, but yeah, that's very thoughtful feedback. So thank you for sharing that. Um, all right, here is a question. Can you talk more about current therapeutic vaccines currently in trial for cervical dysplasia?
Hmm. I'm gonna have to do some research on that. Nothing comes to mind. Cervical dysplasia is like really, really early stages of we're just starting to be worried about cancer. So that's actually when I do a lot of international work where pap smears and HPV testing is just it's not possible given the low kind of resources that these countries have. And so we're actually screening with something like acetic acid vinegar for cervical dysplasia, and we're treating, if we find it, we're treating right away with cryotherapy. So I wouldn't necessarily say that I'm aware of vaccinations revolving around cervical dysplasia, but there are some really neat, innovative ways to treat it in kind of low income settings, um, developing countries around the world.
Okay, we'll see if we can find something about that. I'm going to play off the next comment. For clinical trials information, go to clinicaltrials.gov. You can research studies for newly diagnosed patients are available too. So that would be a good place, a good database. It's one of the action links I was thinking about putting in the show notes. If I can find anything more specific to address that previous question, I will add that to the show notes as well. So thank you for that question. The last one I have here is I'm a holistic health practitioner. Okay. I had traditional treatment, but unincorporated holistic medicine, and I had a remarkable recovery. I also tell clients it's good to combine. It's good to combine. So there you go. It's not A or B. It can be A and B, just as you said. Very good. Okay. So that is the last in that particular box. I've got one more over here. I'm worried my cancer will come back. Can I do anything, diet, nutrition, really anything, to reduce the chances?
Obviously, I don't know the particular case, so I won't be able to comment specifically. I will say that, um, I've been asked that question time and again, no matter who I'm dealing with, no matter where I am. It's the same question, the exact same question, and variations of, what do I do, doc? What do I do differently? How do I help heal myself? I'm scared. How do I improve my situation? And I have kind of traveled far and wide trying to find the answer to that. And yeah, sure, we can talk stress management techniques and nutritional changes and physical activity recommendations and so on and so forth. But I would say, in my humble opinion, the missing puzzle piece truly is mindset, right? So that fear is not going anywhere. We cannot, there's this whole concept of fearlessness is to me ridiculous, because fear is built into the human brain. Like, we have evolved to be fearful. And so it's about managing these sorts of things. And that is when I bring it back to spiritual practice, whether that for you is prayer, meditation, nature walks, conversations with loved ones, writing. Spirituality can literally be anything or everything. Mindfulness, coming back over and over to a centered way of looking at things, will make you realize that we're all passing away at some point. That of course you're going to be scared, but can you live with the fear and live your best life? Right. So that's not a specific answer to your question, because I think you can Google superfoods and all sorts of other things to help you. But again, it's a mindset shift, a perspective outlook that is literally what makes people do great. That is what they're doing. They are looking out with rose-colored glasses every day of every year. And so I'll end with that statement.
Reminds me of a song lyric, we're all on a fortune hunt that's far too fleet, or something like that. That's a bad paraphrasing, but more or less. One last comment, FYI, current therapeutic vaccines, there are some that are now going into phase 3 trials. So we will see what we can find more specifically about that and include that. So thank you for that. Dr. Mamta Singhvi, thank you so much for the time and the conversation today. I really enjoyed this. We went in some areas it was a little bit unscripted. I hope you were okay with that, but it was great. So thank you so much for taking your time to do this.
Thank you so much, Fred, and thanks for everyone tuning in, and all the best on the journey.
Thank you so much. So we've recorded this, dear viewers, like I was mentioning. So if you'd like to watch it again, or maybe send a link to somebody who you think would like to see it, we'll have it up soon on the main NCCC website, nccc-online.org. So thank you, Dr. Singhvi. Thank you to everybody who has attended for all the questions and feedback. That was great. Please follow us. We're at Stop HPV Cancer on Twitter, so you'll get all the scoops whenever we're doing events or things like this. So we would love to have you do that. And thank you again. Have a great holiday weekend, and I'll see you next time. Bye.